And joining us now is Cardiothoracic Surgeon Dr. Jason Williams from Singing River Health System. And Dr. Williams, thank you so much for joining us today. And of course, this is something that we've heard about before, and it affects a lot of people, and heart patients definitely seeing an impact. And also, how does the disease itself affect the heart?
Well, there's the disease itself can cause a myocarditis, which has been reported. It's been discussed with regards to the virus and also with the vaccine to some degree. Although I got to say that's very uncommon with both the virus and the vaccine. And I would say that the bigger issue is patients with heart disease and other cardiac comorbidities who then develop the virus. That's the group that is at higher risk of having a lot of trouble with the virus and ultimately succumbing to it. So I think that when the two diseases come together to attack one patient, that's where the biggest problem lies.
Dr. Williams, are you seeing a lot of heart patients who chose not to get the vaccine who end up with more problems than others?
In our practice, the majority of the patients that come to see us at this point are vaccinated. And I think that that's probably a result of the fact that the majority of our patients are in the elderly cohort, so 70 and 80 years of age. And there was a bigger push to vaccinate those folks earlier on in this process. So a lot of them come to us fully vaccinated. We do have some that come to us who are not vaccinated. And if those patients require elective cardiac surgery, we are currently requiring them to get a vaccine because when they are in the hospital surrounded by patients who have COVID and they are immunosuppressed after a big operation, they are at the highest risk for having problems. And so we don't want to put them at any further risk than they already are. So we ensure that they're vaccinated before we bring them to the operating room.
Right, and that brings up another question, how COVID just kind of affects the day-to-day operations at the hospital, and that's one of the things you have to look out for, I guess.
It is, and really the other thing, specifically with regards to what we do in our team, just about every one of our patients that comes out of the cardiac operating room has to go to the ICU. And unfortunately, the vast majority of ICU beds in the state are taken up by patients who have COVID and who are suffering through a prolonged bout of COVID in the ICU. We don't have enough beds in our hospitals and in the state to be able to do the number of cardiac surgery operations that we need to do in order to be able to take care of the patients in our communities. And that's where we're seeing the biggest impact in the heart patient population.
Yeah, I can definitely see that. And one last question, because a lot of people are concerned about this, especially with the possibility of the booster shots opening up to the 65 and older group fairly soon. How important is that booster shot in your mind to your heart patients? And do you have a lot of them who are hoping to get them in that age group?
We talk about it, and I think the majority of people who have already been vaccinated believe in it enough that they will probably also get a booster. I think that the recommendations of who should get boosters and when are still being hammered out nationally amongst the leaders in this healthcare crisis. And I think we have to continue to look to them to determine who really should get the vaccine or the booster and who's going to benefit the most. But as of right now, I would say the majority of our elderly population who have cardiac disease are going to fall into the category of somebody who probably should have the booster to help bolster their immunity.
All right, Dr. Jason Williams, cardiothoracic surgeon at Singing River Health System. Thanks so much for joining us today.
Thanks for having me.